Welcome to Arkansas First Review, the podcast where we break down the issues that matter most to Arkansans from a conservative, common sense perspective. I'm your host, Kandi Cox, and today we're tackling major battle happening at our state, one that affects your health care, your wallet, and your ability to choose where you get your prescriptions. House Bill 1150 is at the center of the fight. This bill is designed to stop big insurance companies and pharmacy benefit managers, which are known as PBMs, from monopolizing the pharmacy industry, ensuring that local pharmacies can continue serving their communities without corporate interference. But here's the problem. Massive corporate interests don't want this bill to pass. They've launched a statewide misinformation campaign spreading fear and misleading claims about pharmacy access to confuse and mislead Arkansans. So, today we're cutting through the noise and getting the truth from someone who knows exactly what's at stake. Joining me today is Blake Torres, pharmacy and co owner of Westside Pharmacy. He's also a member of the Arkansas Board of Health. Blake has been in the front lines of this fight, pushing back against the corporate influence and standing up for local pharmacies and patient rights. Blake, welcome to Arkansas First.
Hi, and thanks, Candy, for having me today. Wow, what an introduction. I mean, we can stop it right here and say thanks and then move on.
I love your posts when you get something that you're passionate about on Facebook, which is what initially got me to reach out to you on this. As soon as I saw it, I was like, oh, Blake and I have to talk about this because I read the bill and oh, I'm excited about the bill. And so when you put out there about the misinformation and the pushback against this, I went back immediately to a local pharmacy that closed their doors and sold out to a larger pharmacy. And you had made a post back then about that as well. And I immediately went back to the post that you made then in my head. So I just thank you for coming. And we've got a lot to discuss about 1150, right? House Bill 1150.
That's correct. Yes, there's once again, Arkansas is leading the nation on pharmacy benefit manager reform. And House Bill 1150 is just another line in the way that hopefully our legislation that will pass will again protect patients and allow better access. And I look forward to discussing that with you today.
Great. Thank you. So let's start with the basics. Can you break down for our listeners what HB 1150 actually does and why it's so important?
Great question. And to be able to do that, I think we need to kind of take a step back and define what is a pharmacy benefit manager. It's a term, PBM, that most people probably have never even heard of. And what is a PBM? PBM is a large corporation business that is basically a middleman between you, the patient, your insurance company, drug manufacturers, and the pharmacy. And originally they were designed, their purpose was good. We used to have to file paper claims way back, well before my time.
Right.
And it was a process to understand what coverage you had from a pharmacy benefit standpoint, whether a prescription would be paid for or not. And so these companies were created to streamline that process. However, as time has gone on, they have taken that streamline, inserted themselves in between, and basically become almost a mafia. So there are three companies that control over 75% of all prescription transactions. And by having that much power, they have basically pushed upon the market and thus pushing upon patients negative outcomes. And so getting back to House Bill 1150, because of this power and this consolidation, we have insurance companies that involve PBMs, CVS Health, CVS Caremark, who now own pharmacies as well. And so they've created vertical integration which in vertical integration in and of itself is not a bad thing. Sometimes if done in the right way, we can help control costs. However, if that vertical integration is for profiteering and not for patients, that's where we have problems. And that's what we're seeing in the pharmacy industry. And so this bill, at its very core, eliminates that vertical integration from occurring. It prevents PBMs from owning their own pharmacies.
Gotcha. Okay. So, from what I understand, this bill is really about stopping the PBMs from controlling both the pricing and the pharmacy. Can you explain how that works and why it's such a problem?
Correct. Great question. And that's exactly right. So in the current model, we have a PBM, which is the price setter. So they determine how much a pharmacy is paid.
Hmm.
Both pharmacies they own and independent pharmacies or other chain competitors like Walgreens, Walmart, Kroger. And then they are also the price taker. So not only do they determine reimbursement uh, based on a insurance design that they contract with insurance companies, but then they are on the receiving end of that payment. And that's where we've seen some of the most outrageous differences in price payments that for any of the common Arkansan would say that's just wrong. And to give an example, this was in the Federal Trade Commission's most recent report. They showed where a PBM paid its own pharmacy $19,200 for one medication. That exact medication at a local independent pharmacy was, I want to say, $97. So astronomically difference in pricing.
Mm.
And the way that probably relays back to the patient is those differences in cost, in those payments, directly impact patients' premiums or Kansans' premiums. Tax dollars that are not flowing to your local communities, that are flowing to out-of-state companies in New Jersey and Ohio and Florida and Texas.
Gotcha. Okay. One of the biggest talking points from opponents of this bill is that it will limit access to pharmacy services for Arkansans. Some are even claiming that 2.7 million people will be affected. What's your response to that?
So with any piece of legislation, there's always two sides. We are not blind to see that there may be patient impact that would occur. So I'll start at the end. The 2.7 million lives impacted. Well, there's only 3 million people in the state of Arkansas.
Right.
Ballpark.
Right.
All those 2.7 million do not fill at mail order pharmacies and then do not fill at their local CVS. So in and of itself, saying that 2.7 will be impacted is just entirely false because we're not having closures on Walgreens, on Walmart, on Kroger, on the Harps, on your local independents. From a mail order standpoint, the Board of Pharmacy reports, and this number changes based on licensure application, but there are over 900 mail order pharmacies out there. And I would say with confidence that at least 80% of those are not PBM affiliated. So there are still options and access for those Arkansans. We're just not going to allow it to be under a vertically integrated network that drives up cost and steers patients to pharmacies and healthcare providers that they don't want to use.
Gotcha. Let's talk about the misinformation campaign you mentioned in your social media post. Who's behind this? Who's behind pushing back on this bill, and what kind of false claims are being spread?
So our best research shows that an organization called PCMA, which is a national lobbying group across the country that primarily represents and entirely represents PBMs, the biggest three, which are CVS Caremark, Optum, RX, and Express Scripts. And that's their national lobbying body. They've testified. They testified most recently on Rule 128. I'm sure they'll testify here in Arkansas State Capitol on House Bill 1150. They're doing their job, right? I think I saw this morning that PBM lobbying was ranked 11th on total expenditure on the federal level. Millions and millions of dollars that are not for patients. They're to protect those profits.
Right.
And Kandi, don't get me wrong, I am all for capitalism. I think it's the greatest model there is.
Right.
But what we don't have in the pharmacy and really the healthcare industry right now is a level, fair, anti-competitive playing field. We have an oligarchy where a select few of really, really powerful trillion-dollar industries control your healthcare and they're controlling my healthcare. And it's time to put a stop to that.
Could not agree more with that statement. That's exactly right. Um, why do you think these big corporations are going so far as to fund an organized effort to fight HB 1150? What do they have to stand to lose?
The primary standpoint to lose is profits, it is dollars. Right now, because they own and design the pharmacy benefits portion, they're able to steer, that's one way they generate profits, steer patients to using a pharmacy that they don't want to use.
Right.
Whether that's a local pharmacy in CVS, which we had one close here in Benton a couple years back. Or they're being steered to a mail order. I can guarantee there's people that listening to this podcast that you talk to at church that they're being forced into a mail order pharmacy or CVS that they do not want to use. So that revenue stream with House Bill 1150 will go away. The other way is we are providing additional light in what has been a dark place, a place full of shadows and secrets, right? So we're pulling back that curtain in hopes to generate a fair marketplace where we can eliminate that spread pricing and that payment differentiation that I alluded to earlier, where $19,000 to the mail order, $97,000 to the local pharmacy. Those dollars and that benefit's going to go away from them. So they are fighting really hard not to protect patients, but to protect their profits.
Right. Right. There's a claim that restricting PBMs from owning pharmacies will somehow drive up those costs. And yeah.
So I would ask that based on this.
Huh.
Have your healthcare costs, pharmacy-wise, have they gone down?
No.
Okay. So we created a vertical integration model on the foundation of promise and savings.
Right.
Yet for some reason, we're seeing drastic increases in spending, premiums going up, co-pays going up, cost of medications and employee benefit. I had a local employer reach out to me in the last couple of weeks, a large one, and they were asking how do they create savings within their pharmacy benefit design.
Right.
And we had an honest conversation on cost disparities between why they were being charged one price at CVS and a different price at my pharmacy and a different price at Walgreens. And it's because we have this curtain that hides this. It is designed that way. PBMs do not want transparency because when you don't have transparency, they're able to add costs and deception from employers to pharmacies to patients.
Can you walk us through what happens when a PBM owns a pharmacy and also controls that pricing? Like what the impact on patients in terms of cost and access is?
So we'll start with access first. And so the real example I would give alludes to Smith Caldwell closing, which was very much sad for Saline Countyans.
Right.
And but what people don't understand is Smith Caldwell did so much more than just put prescriptions pills in a bottle.
Right.
They had long-term care arm, right? Taking care of nursing homes. And the hospice, hospice is probably what I would speak to the most in that question, is when you steer patients to either mail order or CVS where they're having to drive miles to receive a prescription, those patients who had difficulty in getting to a CVS and rely on, say, delivery aspect, and not delivering to the mailbox, but delivery action to their front door because they're in a walker or they're on an oxygen tank.
Right.
That access would go away. And we're talking right now on Sling County, which I know that's where I represent my main store, but I have stores all across the state of Arkansas. And so what we're going to end up doing if we're not careful is creating pharmacy deserts where your local independents, even some of your local chains like Walgreens, Kroger, they end up closing shop, and patients are going to be having like 40 miles or more that they're having to commute just when their kid tests positive for the flu, spikes 104 fever, and they need Tamiflu.
Right.
So that access will be impeded. I hope that answers your question.
Yeah. Yeah. Have you personally seen patients struggle with affordability or access because of PBM controlled pharmacies?
Yes. The access is the biggest thing I would say. I had a patient just this past week. I actually thought of you after we had scheduled this. They have a child who's on an injectable autoimmune medication. Very, very important. They had been receiving it from a mail order pharmacy. The mom calls me and is like, "Can you help us out? Our doctor sent it here. We really didn't want to go there, but that's where we've been. And they're having trouble getting it billed correctly. And thus, we're 2 days from missing his next injection, right? That's 2 days from them billing it and mailing it and the patient receiving it. So more than likely would have missed the mark. All that to say, our team over at Westside reached out to the doctor, got the prescription, filled it, got it billed correctly so the copay was affordable, and mom was able to pick up the medication that same day. So the access portion will only be amplified if we don't draw a line in the sand now, which is what House Bill 1150 does. Is it gives the power back to the patient in access and choosing where they want to get their prescriptions filled, as well as it maintains our network of pharmacies and stability for long-term, hopefully generational care across the state.
And I personally see the benefit of the smaller hometown pharmacies. I have a special needs daughter, and so a lot of her stuff has to be compounded. And when she was younger, to have access to that without waiting for someone like a CVS to have that mailed in before I'd have to wait for it because, for her, time was everything. And so we switched very early on to our local pharmacy, such as Westside, because of where we saw such a difference in the quality of care that our child got with her medications that she needed so quickly.
Yes.
Yeah. So let's talk about independent pharmacies. If HB 1150 doesn't pass, what's the future for locally owned pharmacies in Arkansas?
Dark
Yeah.
and grim, unfortunately. And I will say that to set a fear in the hopes of House Bill 1150. You referenced it early on. I've been speaking and trying to get the word out for over a year. And you can go back prior to that Smith Caldwell post. The writing is on the wall.
Right.
We have had a net closure. In the legislative body, it's always talked about, well, you added pharmacies here or there, but we've had a net closure across our state of independent pharmacies and pharmacies in general. Walgreens is struggling. If you monitor their business practices on a national level, and they allude to PBM reimbursement. Walmart said the same thing. So these are giant corporations. So to answer your question, independent pharmacies will be the first ones to go as they continue to tighten those reimbursements, as they continue to maximize steering to mail order and to their own brick and mortar stores like CVS. But it won't stop there, Candy.
Right.
They're coming for the whole enchilada.
Right.
It's
A monopoly.
Monopoly.
Yeah.
Straight monopoly.
Mm-hmm. We keep hearing about mail order pharmacies and how they are supposedly increased convenience. But what are the real risks involved with mail order medication services?
I think you can break it down to a couple risks for mail order. Number one is dependability. So I know, and we're only one shot. I had 2 patients during this most recent snowstorm. Their medication didn't make it on time, and so we had to loan them tablets.
Right.
Right. Well, if mail order is your only option, which is where we're trending towards, then they would have missed doses, right? So I think the dependability is one. The quality of care is second.
Yes.
So, I mean, and maybe at a higher, it should be ranked number 1. And I'm trying to be respectful to my peers who are pharmacists that work in those organizations, those entities, but to be able to pick up the phone and know your pharmacist and talk to them, like we get to know our patients.
Yes.
I may not know everybody specifically by their exact full name, but I know them once I have that profile up. I've had chart notes. We made that relationship over time to I can add value in care, which adds quality of health aspect.
Right.
And that's missing from mail order. I mean, you would have to hit probably 7 different numbers to talk to a real pharmacist before you got there. And honestly, I've been in their mail order warehouses, and I've seen the robotics and all that goes into it, and it's really sophisticated. But you're just a number in that shop. When you walk into Westside or pharmacies across the state, you are more than a number. And I don't say that because it's cliche. Like our fillers at Westside, patients, my people in this community.
Right.
And I'm going to keep fighting for that until I can't.
And you do such a great job at it. And I, as one of your patients, appreciate it. Do you think most patients understand the risk of mail order prescriptions, or are they just going along with what their insurance company tells them?
I think they're going along with what their insurance tells them. I think sometimes they are boxed into a corner where they're powerless. We understand that the economy is tight. Money is tight. Every little bit matters. We are not deaf to those concerns. That's why we want equal access for wherever. Mail order, those medications can be delayed. Those medications can, depending on where they leave it, can be exposed to extreme temperatures. I mean, how hot does your mailbox get?
Right.
In the summertime when it's 105 here in August, right?
Right.
Or how cold if they leave it on the front porch and you're gone working all day taking care of kids. Those are real concerns. Or how about when they deliver? How many times does an Amazon package show up at your house or somebody else's house and it's not supposed to be there?
Right.
And then your privacy is exposed, or that medicine never makes it to you, period. So,
Right.
I don't think patients, I think patients understand. I think at this point, from a regulatory standpoint, we haven't done a great enough job of protecting those patients and giving them access and safeguards to maintain and improve their health.
And I think sometimes patients feel like they have no other options if they're backed into a corner. Like, this is how you have to get it,
Yes.
right?
100%.
And insurance has so much to do with that.
Yes.
Is there any reason why local pharmacies shouldn't be able to dispense those so-called specialty medications, like being used in terms of just justifiably PBM control?
Short answer is no. So I graduated from UAMS,
Right.
College of Pharmacy, many years ago. There was no specialty degree. There's no specialty license. In my professional opinion, those specialty drugs are labeled specialty,
Right.
so they can charge more for them, and so they can restrict access to their own pharmacies.
Right.
And again, the impact goes back to patient access and patient care. So there is no reason why pharmacists like myself or any others across the state who cares about the patient, can offer a high quality care, shouldn't be able to dispense specialty medications.
Do you feel that term's a little misleading?
Oh, 100%.
Okay, because I do too.
Aren't all medicines special? Right? I mean, there's a reason why.
If you need them, that's right. That's right. If this bill passes, what would change for patients in terms of access to these so-called specialty medications?
Great question. So the access should be opened. So I think the opponents would say, well, we're eliminating mail order pharmacies. We're eliminating 37, I think is the number of brick and mortar. So CVS, pharmacies, and there's one other smaller chain that would be eliminated. However, we are ready and willing. Us, Walgreens, Walmart, Kroger, Harps, all of us are capable of maintaining that access. So our motto and our vision is that for plan design with insurance companies wanting their patients to have access to these special medicines
Right.
would allow an open network where any willing provider can care for them and provide those special medicines.
Okay. What is the biggest obstacle standing in the way of HB 1150 passing?
I think the fearmonger and just misunderstanding. When you have $1 trillion industry pouring hundreds of thousands of dollars in lobbyist money into the state of Arkansas out of fear that they are going to lose hundreds of millions of dollars in profits, they're not worried about losing patients.
Right.
They're not worried about losing care and quality. They have no care for patients. They only care about profits.
Mm-hmm.
And so my biggest concern is that, thanks to you, we are telling our story, but our story won't be told. I had a pharmacist text me this morning and said, I just heard on the radio this morning that HB 1150 is bad. What's going on? Like, I don't have hundreds of thousands of dollars to pour into radio and TV ads, right?
Right.
But what I do have, Kandi, is I have relationships.
Right.
And so what I'm hopeful is we are telling our story, whether it's on social media or signage at Westside, and we're doing this across the state. But we need our patients and our community members, whether they get prescriptions filled or not, because one day they will need it, to reach out to their legislators and combat that misinformation and those lobbyist dollars.
That's right. That's right. Have you? Do you know of any lawmakers that are in opposition to this HB 1150, or is it mainly a battle against the big corporate lobbying?
That's a great question. I haven't heard direct opposition.
Mm-hmm.
And while we're on legislators, I do want to give praise to Senator Kim Hammer,
Mm-hmm.
who is actually a co-signer, or he's actually the
Co-sponsor.
Thank you.
Yeah,
My ignorance.
no, that's okay. I was supposed to sit down and have a brief interview with him yesterday at the Capitol about this on Wednesday, and unfortunately, we were getting off to a late start because we were having some technical difficulties, and he had such a busy schedule. So I am hoping to get that scheduled again because we want to get this information out there as much as possible.
Yeah, so I want to commend Senator Hammer and all the work he's done on PBM reform, and talking with our other legislators here locally. They are pro House Bill 1150. Across the state. I think it goes back to your question, is that because of the lobbyist propaganda, some legislators are just asking questions like, what is the true impact? And that's fine. We love questions. We want to be able to tell our story.
Right.
We wish that PCMA would sit down right next to us and we just have an honest discussion, but they've chosen to go a different route through propaganda and misleading facts and positions, and thus we're thankful to you to tell our story and our side.
Absolutely. For our listeners who care about this issue, what can they do to help get 1150 passed?
I think the biggest thing would be help us in educating Arkansans, right? And so they can follow our page, Westside Pharmacy. And we're going to continue to put out information in regards to not only this bill, but there'll be bills in the future that come up. So we want Arkansans to stay active, to stay informed. That's how great policy is made. The second thing is get to know your legislator. Reach out to them, write them a letter, send them an email, call them, ask to meet with them and have a cup of coffee. Share your concerns, right? Like, you don't have to be an expert on the House Bill 1150. Tell your story.
Right.
Tell your story about the time you came to the pharmacy counter and you couldn't fill that prescription there and you had to go elsewhere, right? Tell your story about the mail order not arriving. Tell your story about how your costs continue to climb and climb and climb, yet vertical integration was supposed to save us money. Just tell your story.
Yeah, and I want to interject because telling your story is so important. And people are so, they don't know the process of, like, if a bill's going on, being presented on the floor or in committee, how they can speak on that bill. And I just want everyone to know, everyday citizens, you and I, we can go speak on any bill that's being presented, and it is imperative that we do so. Your story makes a difference. And so, with House Bill 1150, if this is really an important bill to you, and I believe that it's extremely important, make sure to reach out to your legislators, but don't hesitate to come up to the Capitol when this is being presented and sign up to speak for this bill. You'll be called on. You give your story, and you just never know the impact that your story is going to make in that decision. And I know a lot of people get really timid about that, but that is where our legislators are. That's our house. That's the people's house. And so you can go up there and speak and let your voice be heard. This bill has been read and referred to Committee on Insurance and Commerce. The sponsors, as we were talking about, you've got Senator Kim Hammer and Representative Moore. And you said that, have you spoken to Kim Hammer personally about this?
Yes.
Okay. And how about Representative Moore?
Yes.
Okay. All right. And ultimately, this is about big corporation pushing for control of the pharmacy market at the expense of patient freedom. What's your take on what this means for Arkansas in the long run?
We're taking our freedom of choice and healthcare back.
Yes, that is a good way to put that. If HB 1150 doesn't pass, what does the pharmacy landscape in Arkansas look like in 5-10 years? Are we at risk of losing more local pharmacies?
Exponentially, yes. Yes, because this will be a gateway, if we don't pass this, for them to further tighten their reins. So we'll continue to see closures like Smith Caldwell. There was the county of Texarkana has no independent pharmacies, so you can imagine what their access is like. It would get far worse really quickly.
Okay. So on the flip side, if HB 1150 does pass, how would that benefit Arkansans, especially in rural areas?
In rural area, they just get access back. They get the relationship of not having to receive care through a mailbox and a phone call.
Right.
They get their local pharmacist and pharmacy team that knows them by name and knows their health conditions and will wake up on a Friday night at 11 o'clock when they have temperature, right? And they need to be flu tested and write that flu script for them and take care of them. That's the quality of care that we are hoping to safeguard and ensure continues for many generations.
Wonderful. Blake, thank you so much for, breaking all of this down for us. It's a lot of information, but it's so important. Is there anything else that you have that you would like to talk to our listeners about, just as a final thought?
No, I think we covered it all. And again, I want to thank you so much for having me on today, Kandi. And thanks for all you do as far as helping tell a story for
Uh,
Arkansans.
Absolutely. You're very welcome. Well, that's it for today's episode of Arkansas First Review. If you've learned something new or want to fight back against corporate overreach in healthcare, share this episode, tag your friends, and make your voices heard. Call your legislators and tell them to support HB 1150. If you want to learn more, make sure to follow us for updates and resources on how you can get involved. Also, make sure to follow Westside Pharmacy. That's Blake's pharmacy, and he does put out a lot of good information. Follow Arkansas First, that's 1ST News on Facebook, X, and subscribe to our contributors' content at arkansasfirst1st.com. And catch my podcast, Arkansas First Reviews, on Facebook, YouTube, Spotify, Amazon Music, iHeartRadio, and Boomplay. Until next time, stay informed, stay engaged, and keep Arkansas strong.